It is American Heart Month, and this year the Cleveland Clinic's 2024 Heart Health Survey takes a look at how Americans are using technology to improve their heart health. Joining us today on more is Director of Cleveland Clinic's Women's Cardiovascular Center is Dr. Lisa Cho. Thank you so much for joining us today.
Hi, thank you for having me.
So what did the survey find?
Well, the survey was very interesting. It found that Americans are enthusiastic about artificial intelligence improving their health. We also found that majority of Americans have asked artificial intelligence like ChatGPT to ask about medical questions. But thankfully, 90% of patients have actually verified that information with their physician. So that's very reassuring for us. The other important finding was that they found that 50% of Americans were using wearable technology to improve their health.
What are some of the advantages of AI-driven technologies that are used in promoting heart health?
Well, one of the advantages of AI-driven technologies for health is that we're testing the technologies to see if we can identify patients who will go on to have disease later on at an earlier stage, really trying to use that technology to personalize medicine, to figure out if a certain medications work for you or not. And then, of course, trying to fine-tune the way we diagnose our patients.
The survey highlights the positive mental and physical impacts of wearable technology. How would you encourage patients to utilize wearable technology to help enhance their heart health?
Yeah, the survey was very interesting in that point, is that 50% of patients wear these wearable technologies, and then they think by wearing them, they have improvement in their physical and mental well-being. They are, walking more. They are eating less. They are, keeping track of their sleep and maybe becoming more aware of their sleep hygiene. And so, for some of our patients, where we talk about losing weight or trying to decrease blood pressure or improve their cholesterol, keeping track of your steps are really important. And so, sometimes I tell my patients, because a lot of people have these technologies already, to perhaps use that, to leverage that, so that maybe they're walking 7,000 steps a day, but maybe by the end of the month, they could be aiming towards 9,000 steps, and then finally to a goal of 10,000 steps. Maybe keeping track of calories, but not just that, but also salt intake. So just helping patients understand how to use these technologies to target their medical problems.
Why is it important for patients to use AI and wearable tech responsibly in conjunction with medical advice from a provider?
Well, I think it's overwhelming. Some of these AI or even wearables can be that, it's just overwhelming the amount of data a patient can get through these devices. What's important? Like peak VO2, I've had so many questions about peak VO2 that can be found on an Apple Watch. What's important is to talk with your doctor about what are the goals of our medical care. Is our goal to lose weight? Is our goal to control blood pressure, control cholesterol? And then using the technology to really leverage how to achieve those goals. It's also important to know what's important and what's not important, because sometimes people can become overwhelmed with this data and become obsessed over these data. So it's important to sort of hone in on what's important, when to use it, when to track it, when to ignore it, which is another sort of key information from these devices.
Where can our viewers go for more information?
They can go to clevelandclinic.org/loveyourheart.